Hey everyone, Sarah Strackhouse with Real News Communications Network, and today I'm talking to Dr. Johnson a little bit about concussions, what to look out for, and some treatments. How are you, Dr. Johnson?
I'm great. Thanks for coming.
Yeah, absolutely. Thanks for having me. And I hear that recently you were at a conference where concussions was a major topic.
Exactly. I was at the International Hyperbaric Medicine Conference, and there were some new studies showing the effects of hyperbaric on concussion and preventing long-term effects.
Okay.
So, which was quite interesting because most of the time with concussions, people are told be quiet, stay out of the bright lights, decrease your stimuli, and your brain will heal.
Right. Well, can you tell me first off, for people who might not know, what is a hyperbaric chamber, and tell people a little bit about where we are right now?
Well, we're at Hyperbaric Centers of Texas at my facility. Hyperbaric chambers are enclosed devices where you breathe 100% oxygen under pressure, increasing the concentration 10 to 15 times to your body.
It's incredible.
Which is a healing process. The brain needs glucose and oxygen for the cells to function. You increase the oxygen, it helps those cells to function better. Normally, 15% of your blood in your body that's pumped by your heart goes to your brain. So it's a vital organ that needs blood circulation, oxygen, and then of course glucose is what helps drive the cells. What happens when a person gets a concussion, they get of course hit in the head or their head hits something, it stops rapidly, jars the person, and then the person may or may not have symptoms afterwards. If they have symptoms, then that's what is termed a concussion, where you have trouble with memory, you may have lost consciousness or may not have, but you have a headache, you have trouble with vision sometimes, difficulty with tolerating bright light, sounds, and so all those things are the things they look at with a concussion. The typical treatment then is avoidance of all those items, rest, and wait. Well, the long-term studies and what the CDC puts out is up to 30% of people that have concussions actually have symptoms up to 30 days or longer.
Wow.
So there's a group of people that don't recover very rapidly and have prolonged symptoms, and some of them, it's for life that they've been dealing with it since their concussion. What some new studies had been done in Chicago showed is with hyperbaric treatment, up to 5 treatments fairly immediately after the concussion occurred, and that's 1 treatment a day.
Right.
That within 5 days, their symptoms in 90% of the patients were resolved.
Wow.
Which is really an amazing situation, particularly when we see kids are trying to get back to school, and if they miss school, they have to catch up. If they have prolonged symptoms, then they're put in special education programs where they're either homeschooled or they have to work at a reduced rate in reduced light and reduced stimuli situations. And many times their brains aren't working well, so they have a hard time learning even though they're in an educational process. So this was really exciting in that immediate intervention or very quick intervention with just oxygen, but it's oxygen under pressure, helps those brain cells to function correctly and to get back and to heal. Hyperbaric's been used for wounds for a long time.
Right.
And healing wounds. And it's a similar process. You're healing the brain. You're healing the injury to the brain.
Which is wounded in this case.
Yes, exactly. It's wounded by the trauma it received.
Sure. So tell me, what can parents, as many of the students are going back to school, many of them are getting into sports. I mean, football, we always hear about it. Soccer, taking headers, any sport really where you can any contact sport, you can fall and hit your head. As parents are sending their kids back to school, what can you tell them to look out for? Is there any advice you can give them when it comes to concussions? What should they be keeping an eye out for?
Well, they need to look for the symptoms, as we talked about. Ask your kid how practice went today. Are you having a headache? Are you having vision problems? If they say, "Oh yeah, I really took a hard hit today in football," or like you say, they headed the ball and saw stars and developed a headache afterwards. All those are little traumas, and sometimes those little traumas add up.
Sure. And
pretty soon you have a true concussion where you have symptoms. So if you fall, trip and fall and hit your head, you can have a concussion with that. There's a doctor recently that fell, and it's 6 months and they still aren't back to work. Wow. With just a plain old concussion from falling down and hitting your head.
Wow.
So the message to parents is be vigilant in asking your kids how they're doing, what happened today at school, how did practice go,
right?
And then if there are problems with it, seek help, seek information. Our website is hyperbaric-centers-of-texas.com, and you can have information there. This will be on the website, so you can re-listen to it if you need to.
Perfect. And then what about that next step? If people want to take their kids in to see someone, they want to see a professional, the kid might be saying, I'm fine, but mother knows best, father knows best. What is that next step? When should they see a professional?
Well, if the symptoms are persisting and it's fairly significant, then they need to see a professional. And a lot of times they go to the ER right away if they've been knocked out to make sure what's going on, because you can have a bleed and more serious problem where you get a brain bleed and then it can kill you. So need to at least go to the ER, see what's going on with the ER, maybe get a CT, a scan if it's indicated and they feel it's indicated. There are some new MRI scans out there that are called DTIs that really look at the brain in a much more detail for concussion type problems.
Right.
So there are things, if you have persistent symptoms or you aren't recovering rapidly, or you want to enhance your type of treatment, which this new study points out.
Absolutely. And I know you might possibly have some studies coming your way, but not just yet. We're talking about that. So if people have any kind of questions, or is there anything else you want people to know?
Well, I think if they have questions, call my office. It's 972-479-0400, and I'll be happy to talk with you. I may have to call you back, but be happy to talk with you and answer any questions you have.
Okay. And then any other, one more time, that website.
Website is Hyperbaric Centers of Texas.com.
Perfect. Dr. Johnson, thank you.
Thank you.
All righty.